Thank you, Charlie. Well, Mercy Health Muskegon leaders are calling on community members to get vaccinated. They say COVID is one factor leading to extended wait times in the emergency department. And they say the decision to shut down Hackley Hospital is not a reason wait times in the emergency department are increasing. Hospital administrators held a discussion today that also included the status of a staffing shortage at the hospital. 13 on your side, Lakeshore reporter John Mills has more on the message Mercy Health is sharing, and he is live outside the hospital. John.
Mercy Health Muskegon President Gary Allure and Mercy Health Muskegon Chief Medical Officer Dr. Justin Grill are both asking community members for patience for those who need treatment at this hospital. They say wait times are increasing in the emergency department, in part because patients are staying at the hospital longer and because of a significant staffing shortage.
Obviously, as everyone knows, this pandemic has caused a significant surge.
A surge and demand for hospital care that's stressing Mercy Health Muskegon. Hospital President Gary Allure saying long wait times in the emergency department are the result of patients staying longer at the hospital. An average of 4.5 days now, up from 3.8 days before the pandemic. Allure says community members who blame extended wait times on a decision to close Hackley Hospital are incorrect.
We're still using all 4 floors on the Mercy campus, and we added a 10-story tower.
Allure says the towers increased hospital capacity, the pandemic and a staffing shortage, both testing capacity.
We did add the capacity to take on the additional volume that we're seeing, but it's very, very tight.
Dr. Justin Grill adding healthcare providers, including Mercy Health, are all facing staffing shortages. There are 500 open positions right now at Mercy Health Muskegon.
Our nurses and our physicians are working as hard as they can, maintaining quality of care, and we will do that as rapidly as we can. But it is a strain on the healthcare system right now.
The hospital is getting assistance from staffing agencies, using a colleague referral incentive program to fill positions and offering retention incentives for current staff.
The retention bonuses and whatnot that Gary Allure and Justin Grill talked about were submitted to us today.
Cindy Zenowick and other members of the Service Employees International Union are just now reviewing the hospital's retention incentive proposal. She says she's also owed crisis pay for taking on extra shifts during the pandemic.
And as far as I know, nobody in my department in respiratory therapy got their crisis pay.
And Zenowick believes the extended wait times she's aware of can all be tracked back to one thing.
Wait times in the emergency room are 3, 4, 6, 8 hours. And it basically just all boils down to staffing.
It's a problem Zenowick says is causing something else at the hospital.
Morale is bad. It's very bad. We're burnt out, we're tired, we're short-staffed, we're not appreciated, we're not paid. The culture over there is horrific right now.
And Muskegon County remains in a very high rate of COVID cases. Hospital leaders are asking community members here on the Lakeshore who haven't been vaccinated to do so now. They believe that that would help reduce the strain on the hospital system. And Juliet, I'll have more on this story tonight at 6.